got a great question about someone that has a shaped implant that has moved, and the question is what to do about it. Well, when you have a shaped implant that has shifted, you really don't have a lot of options other than surgically revising that implant. And it allows us to illustrate another important part in plastic surgery about these breast implants. Most breast implants are round breast implants. Now we're going to be using the silicone gel implants here as a example, but it applies to the saline as well. But there are shaped implants that is shaped as a breast. You know, it's wider on the bottom and thinner on the top. It sounds great. In reality, there are, in my practice, limited applications for the shaped implant, and the reasons are, I'll explain. With a shaped implant, the implant, I'm going to use this example right here, is thicker on the bottom and thinner on the top. So if I turn this to the side, you can kind of see it's thicker on the bottom and thinner on the top. Whereas a round implant is round all the way around. See, if I turn this thing, it's round. Now here's what happens. When you put this shaped implant in place, it has to be so it's properly positioned. If it should shift later, you see what happens here? The thick part is now over here and up here, not along the bottom. So if I turn this to the side, you can kind of see what happens. If this rotates, you see that silhouette is going to look a little different, a little funny, so to speak. Now you got the thick part up here and the thin part there. What that means in practice is that if it should rotate in the body, now you have the breast can look a little different and it can look a little strange. Look what happens with a round implant. This is silicone gel. Notice when I'm holding it, it's thicker on the bottom and thinner on the top because of gravity, right? But because it's round, if I hold it here, it's still thin at the top and thick at the bottom. So this can rotate in your body all at once. You're not going to see a difference because the thicker part along the bottom is always going to be the gravity dependent part no matter which way the thing should turn. So for that reason, that's an example of what happens with the shaped implants in some cases. Now, scientifically speaking, there have been some studies where they have put in these implants, the shaped implants and round implants, and then had different assessors try to figure out who had which kind of implant in place. And the surprising finding, well, not so surprising for some people, but surprising for others, was that there really was about a 50% chance of being able to tell. So in other words, it's a coin flip. That being said, because there are the problems potential with the shaped implants as opposed to the round, in most cases you want to use the round implants. And again, going back to our initial question, there is surgery required to revise that if the shape is not pleasing because it has moved. That being said, the shaped implants do have some applications in some patients with particular types of anatomy and in certain reconstructive options. So it's not that they're not useful under any circumstances, it's just that there is a limited set and you have to have careful patient consideration to make sure that we get you an operation that's going to last you a long time with a low chance of having preventable problems that would require further care. So again, a little bit of a long answer, but I think it's a good review of the issues with the shaped versus the round implants. So thanks for the question, and we will see you next time.